Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. I bid to our lecturers, Syed Rizaini and the fellow friends. Inshallah, today my group 2 from LO1-PO1 would like to present our topic, otoscopy with UV and visible spectroscopy. First and foremost, let me introduce you guys with our team members. So my group consists of 5. I am Nur Fatia Inshira binti Mubarak, my partner Iman Akila Baiduri, Nabila Najwa, Aina Balkis, and my Sarah Safira. Without further ado, let's move on with our first topic, which is otoscopy. So otoscopy is a clinical procedure that used to examine the ear canal and eardrum to diagnose our ear condition. So the principle and the fundamental of otoscopy involve using an instrument called an otoscope, which combine a light source and magnifying lens to provide a clear view of the ear structure. So the principle of otoscopy involves 3 parts, which is the first one is visualization. So the main principle of otoscopy is to allow the healthcare professional to visually inspect the ear canal and the eardrum. So the otoscope provide illumination and magnification to enhance the view of the ear structure. Secondly is non-invasive examination. So otoscopy is a non-invasive diagnostic tool which helps to identifying various conditions like ear infection, earwax, blockage, perforated eardrum, and other abnormalities. Thirdly is real-time observation. So the otoscope allows for real-time observation of the ear canal and the eardrum that can immediate diagnosis and help the decision making. Secondly, move to the fundamental component of this otoscopy or otoscope. The first one is it had a speculum. So what is speculum? It is a cone-shaped attachment that is inserted into the ear canal. So it comes in various sizes to fit different ear canal size, and it can be disposable or reusable. Secondly is magnifying lens. So this magnifying lens can enhance the view of the ear canal and eardrum to allow for detailed examination. Thirdly is the handle and the head. So it has handle which contain the power source, usually batteries, and provide a grip for the examiner. And lastly, it had head which is contain the light source and magnifying lens, which is this light source can be either a bulb or an LED. With the principle and the fundamental, now let's move on with the block diagram of the otoscope. So here is the block diagram of the multi-wavelength fluorescent otoscope. This is a more advanced device that used to visualize the middle ear in more detail than the traditional otoscope. So here, I would like to explain each component labeled in the diagram. So as you can see, firstly, it has ear tissue. So these are referring to the tissue of the middle ear that the otoscope is visualizing. Secondly, you can see there is otoscope head. So this is where the magnifying lens and illumination component of the otoscope are placed. Thirdly, speculum. So a speculum is a disposable cone-shaped piece that fits gently into the ear canal to hold it open for better visualization. At the center, you can see it had filter wheel. So this component allowed the otoscope to select different wavelength of light to illuminate the ear canal. Next, it has magnifying lens. So this one provides a magnified view of the ear canal and the eardrum. It also had LED mounted on the heat sink. So these LED are used as a light source of the otoscope, and the heat sink help to dissipate heat generated by the LED. Next is LED control switch. We also had this switch to turn the LED light source on and off. And then CMOS camera. So this camera capture image of the ear canal and the eardrum illuminated by the different wavelength of light. And then it had otoscope base. So the base of otoscope are likely consist of battery or power supply and other electronic components. Next is mucosa. So mucosa referring to the mucous membrane that lines inside of the ear canal. And next, it will go through to the data recording and display. So these are referring to the computer system that is connected to the otoscope and is used to record and display the image captured by the CMOS camera. So overall, the block diagram shows how the multi-wavelength fluorescent otoscope use various components to illuminate the ear canal with different wavelength of light. It can capture image of the ear canal at different wavelength and display those images on a computer screen. So in comparison to the traditional otoscope, a multi-wavelength fluorescent otoscope offers a more detailed view of the middle ear by capturing image at different wavelength. So this can help doctors to identify abnormalities in the ear canal and middle ear tissue. Thank you.
Alright, so next I will explain about the formula and operating graph. So this device typically consists of a handle, a head with a light source, and a magnifying lens. Hence, the formula and its related operating graph for the light source is first one is illumination versus distance, where the brightness of the area being examined is typically decreases with the distance from the light source. So this operation can be modeled using the inverse square law, similar to how light intensity behave in physics, which is the formula is as shown below, where I is the illumination intensity, the D is the distance from the light source, and the operating graph as shown in the slides, where it shows the intensity of illumination decreases as the distance from the light source increases. As the magnifying lens, its operating graph is a field of view versus magnification. In this operation, as the magnification increases, the field of view will be decreasing. This is a trade-off that is managed by the otoscope design to provide a balance between the detail and the context.
Next, I will talk about advantage and disadvantage of otoscopy. First, let's go through about advantage of otoscopy. On the first advantage, it is a quick and easy to perform. Otoscopy is a quick and easy procedure that can be performed in just a few minutes. This makes it valuable tool for diagnosing ear problems in both children and adults. Second, it is painless. Otoscopy is a painless procedure. The otoscope is a small, lighted instrument that is inserted into the ear canal. The otoscope does not touch the eardrum, so it does not cause any pain. Third, it is effective in diagnosing ear problems. Otoscopy is an effective way to diagnose a variety of ear problems, including ear infection, otitis media, swimmer's ear, earwax buildup, and injuries to the ear canal or eardrum. And fourth, it can be used to monitor treatment. Otoscopy can be used to monitor the progress of treatment for ear problems. By looking at the ear canal and eardrum over time, doctors can see how well the treatment is working. Next is the disadvantage of otoscopy. First, we have the limited view. The otoscope only provides a view of the ear canal and eardrum. It cannot be used to examine the inner ear or the middle ear. Second, it may cause discomfort. While not it is painful, some people may experience discomfort when the otoscope is inserted into the ear canal. This is especially true if the ear canal is swollen or inflamed. And lastly, it is required experience for proper interpretation. Otoscopy requires some experience to perform properly. Doctors need to be able to correctly identify the different structures in the ear canal and eardrum.
So next, I'm going to present the limitation of otoscopy. First, otoscopy give a limited field view, which it provide a narrow, limited view of ear canal and eardrums, potentially missing a peripheral pathology. Next is obstruction. Earwax, forehead body, or swelling can obstruct the view, making it difficult to perform through examinations. Lastly, the limitation is limited light and magnifications. Standard otoscope may have insufficient light or magnification, making it hard to identify the subtle abnormalities.
Otoscopy is a crucial diagnostic procedure in medical practice, offering a direct and non-invasive method to examine the ear canal and eardrums for various conditions. Here are the three examples of otoscopy application. The first one is diagnosing ear infections. So, as mentioned before, otoscopy is an essential tool for identifying ear infections such as otitis media, middle ear infection, and otitis externa, outer ear infection. By examining the ear canal and eardrums, healthcare providers look for signs of infection such as redness, swelling, and pus. In otitis media, they may see fluid build up behind the eardrums. while in otitis externa, the ear canal itself may appear inflamed and swollen. Early and accurate diagnosis through otoscopy allows for timely treatment, often with antibiotics or ear drops to prevent complications. The second application is hearing loss investigation. When a patient experiences a hearing loss, otoscopy helps determine if the loss is conductive due to blockage or damage in the outer or middle ear, or sensorineural related to inner ear or nerve issues. Otoscopy can reveal earwax buildup, perforation in the eardrums, or fluid in the middle ear, all of which can cause conductive hearing loss, and identifying the cause is crucial for deciding the appropriate intervention, whether it's removing earwax, treating an infection, or referring the patient for further audiobiological assessment. And lastly, the third application is foreign body detection. Children often insert objects into their ears, which can cause pain, infection, and hearing issues. Otoscopy helps identify and locate these foreign objects, which can then be carefully removed. This is crucial to avoid potential damage to the ear canal or eardrums during removal. In adults, foreign bodies like insects or cotton swabs can also be detected and managed appropriately through otoscopy.
Next is the principle and the fundamental of UV visible spectroscopy. So it's also called as UV spectroscopy. It is a method that involves understanding how light, particularly in the ultraviolet and also the visible spectrum, interact with atom, ions, or molecules. The interaction leads to the movement of particles from one state to another state, which is from the low state to the higher state. Okay. At its core, UV visible spectroscopy involves shining ultraviolet or visible light through a sample and measure how much of the light is absorbed. It uses both quantitative and also qualitative technique. They often use Beer-Lambert law to make comparison between the absorption and also the transmitted. Lastly, the purpose is to identify the substances within the sample by analyze the absorptions of light. So now we're going to go through the Beers-Lambert's law. So first, Beers-Lambert's law state that material sample path length and the concentrations of the sample are directly proportional to the absorbance of the light. So the formula is A equals to epsilon LC. So A is the amount of light absorbed for a particular wavelength. Epsilon is the molecular extinction coefficient. L is the distance covered by the light through the solutions. And C is the concentrations of the absorbing species.
Nabila Najwa for the introduction of the UV visible spectrometer. Now I would like to continue with the block diagram of a single beam UV visible spectrometer. So here are the background of the component. The first one, as you can see, here are the light source. So this light source emits light that cover a wide range of wavelength. It typically including both UV and visible light. The common light source for UV visible spectrometers include deuterium lamps for the UV range and the tungsten lamp for the visible range. Secondly is entrance slit. So this entrance slit collimates the light from the source. Collimation refers to a process that strengthens out the light ray, making them all parallel. So this helps to ensure that the light interacts with the sample uniformly. Thirdly is monochromator. So monochromator separate the light from the source into its component wavelength. So it works by allowing only a narrow range of wavelength to pass through at a time. The wavelength of light that is allowed to pass through can be adjusted by rotating a diffraction grating within the monochromator. Next is exit slit. So this exit slit collimates the light that has been passed through the monochromator by a specific wavelength. And then it has sample. So this sample, the collimated monochromatic light from the exit slit, it will shine through the sample. So the amount of light that is absorbed by the sample depends on the sample composition and the wavelength of the light. and then it will go to the detector. So this detector will measure the intensity of the light that is transmitted through the sample. So the detector will convert the light intensity into an electrical signal. So this plot diagram shows that the intensity of the light is not measured before it goes through the sample. So this characteristic of a single beam this is the characteristic of single beam spectrometer. In contrast, a double beam spectrometer split the light source into two beams, one of which pass through a reference cells and the other through the sample cell. So this allows the spectrometer to account for fluctuation in the intensity of the source light over time. Next, as I said before, there are double beam of spectrometer. So this is the block diagram of the double beam UV visible spectroscopy. What is the difference between the single beam and double beam? As you can see in this table, for the single beam, the light beam is one, and the double beam, it will split into two, which is reference and sample beams. For the measurement, for the single beam, it can measure separately, and for the double beam, it measures simultaneously with the sample measurement. And thirdly, the advantage of the single beam is it is simply designed and a lower cost and provide lower cost, while the double beam, it is more accurate and it is provide faster measurement. And lastly, for the disadvantage, the single beam is less accurate and more time consuming. But while for the double beam, it more complex design and offer higher cost. Thank you.
Next, I will present the formula and operating graph of visible light and UV spectroscopy. First, let's go through the formula. This technique is commonly used for analyzing the absorption, emission, or reflection of light by substances. When light passes through a sample, certain wavelengths are observed by the sample. The observed wavelengths correspond to the energies required to promote electrons from one energy level to another. Using this fundamental law, which is the Beer-Lambert law, relates the absorption of light to the properties of the material through which the equation as you can see on the slide. A is the absorbance, which is no unit as it's a logarithmic ratio. Epsilon is the molar absorptivity or molar extension coefficient. C is the concentration of the absorbing species, and L is the path length through which the light passes, which is A equal to epsilon multiplied by C multiplied by L. Next is the operating graph. As for the spectra, the resulting graph, which is the spectrum, shows absorbent or transmittant versus wavelength, and the peak in the spectrum corresponds to wavelength at which absorbent occurs, where a typical absorbent spectrum will have the wavelength on the x-axis and absorbent on the y-axis, and peaks in the spectrum indicate the wavelength at which the sample observed light. So basically, the UV-VIS spectroscopy utilized the Beer-Lambert law to relate the absorbent to concentration and path length, with spectra display absorbent versus wavelength and calibration curve aiding in the concentration determination.
Next, I will be explaining about the advantages and disadvantages of visible spectroscopy. The first advantage is widely applicable. It is suitable for a wide range of applications, including chemical, biological, and environmental analysis. The next advantage is quantitative analysis. It can be used for quantitative analysis to determine the concentration of substances in a sample through the Beer-Lambert law. And the last advantage is non-destructive. Visible spectroscopy does not damage the sample being analyzed, making it ideal for analyzing precious or limited samples. However, it also has some disadvantages. The first disadvantage is interference. Samples with multiple absorbing species can produce overlapping spectra, making it difficult to resolve individual components. The second one is sensitivity. It is generally less sensitive compared to the other techniques like fluorescence spectroscopy, limiting its use in detecting very low concentrations of analytes. And the last one is limited to colored compounds. Visible spectroscopy is effective only for compounds that absorb light in the visible spectrum, which typically correspond to colored substances. UV spectroscopy also has its own advantages and disadvantages. So the first advantage it is highly sensitive. It is more sensitive than visible spectroscopy and capable of detecting lower concentrations of analytes. It is also can be used in a wider range of application. It can analyze both colored and colorless compounds, as many organic and inorganic substances absorbed in the UV region. And the last advantage is higher precision. UV spectrometers can offer precise measurements, especially when equipped with advanced features like photodiode array. And the first disadvantage is complex interpretation. The spectra obtained can be complex and require advanced knowledge and experience to interpret accurately, especially when dealing with mixtures of compounds with overlapping absorption span. And the second disadvantage is potential for photodegradation. Samples that are sensitive to UV light may degrade during analysis, potentially altering the result. And the last disadvantage is solvent interference. Many solvents absorb in the UV region, which can interfere with the measurement of the sample if not chosen carefully.
Okay, now we go into the limitations of UV spectroscopy. First is the selectivity. UV visible spectroscopy often lacks of specificity because many substances can absorb at similar wavelength. Second, the sensitivity. Uh, the UV spectroscopy not be sensitive enough for detecting very low concentrations of analytics. The detections are higher compared to more sensitive techniques like fluorescence spectroscopy. And the last one is the path length, which the path length of the curve need to be consistent. The variations of length can affect the absorbance light. So that's all.
So the next one is the application of the otoscopy or RE-scope. There are a few applications. Firstly is the diagnostic application, where biochemical analysis application, where it's commonly used to determine the concentration of analytes in solution using the Beer law, which relates observance to concentration, allowing for precise qualification. The second one is a therapeutic application using photodynamic therapy, which is PDT, such as a cancer treatment, as it uses photosensitizing agents that are activated by visible or UV light to produce reactive oxygen, which can destroy the cancer cells. The third one is a research application. The molecular interaction studies on the observation and emission tracks spectroscopy, which studying how the molecules absorb and emit light helps in understanding molecular interactions, binding studies, and conformational changes. So last but not least, the monitoring and detection. So biosensor devices that uses a visible or UV light to detect the presence of pathogens or specific biomarkers. They can incorporate fluorescent tags that bind to specific biomolecules.
And that's it from all of us. Thank you. I hope you all enjoy it.